tear at delivery. So how can you push to avoid tearing at delivery? Today, we're going to talk about different ways to push, different times that we're pushing to avoid tearing at delivery, because the more that you can do to avoid that, it's going to be a big win from someone who tore a lot. I'd love to help you avoid that. And this is after seeing thousands of patients push out their baby in the hospital with my 20 years of labor and delivery experience, plus having 3 babies of my own, talking to millions of you guys online. I'm so glad that you guys are here, because I'm honestly just glad you're even thinking of this, because there are things that you can do, but they're not really what people talk about on social media. So stay tuned. Before we get going, one of the most important parts of this, because you cannot eliminate your chance of tearing in general, is to make sure that you're prepared for postpartum. I actually have a whole postpartum checklist down below that you guys are going to find really helpful, because it's super easy to like grab all the onesies and diapers and all the things that you need for baby and completely ignore yourself. I know that happened to me, but make sure that you have those things on the checklist. Again, I'll link it down below. Okay, pushing at delivery. So ultimately, your baby's in here and your uterus is contracting to get the baby down, but your uterus can only do so much. So a lot of times you have to engage to get the baby to come all the way out from the birth canal so that we can grab them and pull them out and they can live with you for the rest of your mortal life. But I really want to tell you that there are 2 different kind of stages of pushing. And one of them is when baby is still high. Now, there's controversy on if we should let you push right away or if we should let you delay pushing until you feel an urge. Up to 3 hours is what the recent study said. I am a fan of delayed pushing at times, but if you've had a really long induction, you're prone to a hemorrhage, you may want to start pushing earlier. And I got to say, for our epidural friends, a lot of times you don't have that urge. And so it's a little bit different, although you can tailor your epidural. I actually just did a full video on epidural choices and how you can tailor it to you. I'm going to link that down below. But I think the most important thing to know about tearing is that it doesn't happen at this first part. It happens when we're going to pretend like this pelvis is your perineum, because I do not have a crocheted perineum, because that would be weird, unlike a crochet pelvis and uterus. Let's pretend like this appears like your urethra. Down here is your rectum. Usually what tears is here on your perineum, or some call it your perineum. And that happens as baby is crowning. So that's when we're starting to be able to see the baby's head. So this final part is really when tearing happens. It doesn't happen when baby's still a little bit high and we're pushing to get them more down into the birth canal. And I feel like a lot of people talk about pushing the same way the whole time, but it requires giant, long pushes to get the baby into the birth canal, which is a lot of times why we end up using coach pushing, because that works best for people. Now, I have a whole video on different types of breathing and pushing. I'm going to link that down below in case you're like closed glottis pushing, coached pushing. Again, I'll link that down below. But the cliff notes of that is you really need to do what works for you and will get the baby to descend, because I would love to live in a world where everyone gets the fetal ejection reflex, which is what everyone likes to talk about online. But I'm here to live in reality and tell you that not everyone gets the fetal ejection reflex. In fact, I would say it is a vast minority of people that get that reflex who just are able to push that baby out, within 3 pushes, because you know what it feels like. Like when you really need to go number 2 in the restroom, the fetal ejection reflex is similar to that, where, it's coming. You got to go. So I think that's the first thing to understand. And I am a big fan of moving during pushing, moving side to side. If you have an epidural, getting up on all fours. If you don't have an epidural, there's lots of things that you can do. Again, I have videos about pushing. I'll link a couple more down below as well. But all of that is not going to do anything about tearing. Now, the second thing that you can do is ask your nurse to apply a warm compress. Studies have shown that a warm compress, which ultimately just ends up being usually some washcloths with warm water on it, and they can add, rewarm them every half an hour or so. But the idea is that helps to make the tissues a little bit more supple down there. You can have some swelling even when you're doing those long, big pushes at the beginning. So that warm compress hopefully helps with that swelling to make it a little bit more pliable as baby comes out. Big fan of the warm compress. But one of the most important things that people don't seem to talk about online is right at delivery, it's super important that you're listening to your provider. And once again, I'm going to use this pelvis as this is the perineum down here again. Your provider is going to coach you to do small, tiny little pushes. This is when you want to use that open glottis pushing, because you don't want to just boom that baby out of it. You want those small pushes to help the tissues around here stretch to allow baby to come out without tearing. Now, the bad news is there really isn't anything that you can do to completely avoid tearing at delivery. I actually have a whole video with some other things that you can do, like perineal massage to avoid tearing, but this video just focused on how to push to avoid tearing. So watch that other video to learn a little bit more about how to avoid it. Are you worried about tearing at delivery? Tell me in the comments, but thank you for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth. And please don't forget to prepare postpartum, because you need that. I wish I had done so much better at it.